Creatine after 50 is safe, unless you fall into one of these 7 groups. Listen up. If you are over 50 and thinking about creatine, I need about 8 minutes of your time. That is less time than you spend waiting for your doctor to actually enter the exam room. And this information might be more useful than what you get when they finally show up. Here is the deal. Creatine is one of the most researched supplements on the planet. Over 500 studies, 3 decades of data. A 2025 review in Frontiers in Nutrition just confirmed it is remarkably safe for most adults. But you are not here for most adults. You are here because you have got a medicine cabinet that looks like a pharmacy exploded. You have got conditions. You have got concerns. And you want to know if creatine is going to help you or land you in the emergency room. I am about to give you the 7 specific health conditions where creatine becomes a serious question mark. Not internet myth nonsense. Actual medical contraindications based on real research. Before we start, comment the word active below to get my completely free 30-day workout plus creatine guide for maximum results. This guide is designed specifically for people over 50 who want to build muscle without breaking something important. Comment active and it is yours. Now let us get into who should stay away from creatine, starting with the big one. Severe heart failure. When your ticker needs special consideration. Severe decompensated heart failure requires a conversation before you touch creatine. Now let me be clear about something first, because this section has nuance that matters. Your heart is a muscle, the most important muscle you have, and it uses phosphocreatine for energy just like your biceps do. Research published in cardiology journals has actually shown that creatine supplementation may support heart function in some heart failure patients. Several studies demonstrate improved exercise tolerance and muscle strength without adverse cardiac events. So creatine is not automatically bad for heart disease. In fact, for many people with stable cardiac conditions, it might actually help. But here is where the caution comes in. If you have severe heart failure, the kind where your cardiologist has told you to strictly limit fluid intake, weigh yourself every morning watching for fluid retention, and possibly restrict salt to almost nothing, creatine requires a specific conversation. Creatine increases intracellular water retention. This is water inside your muscle cells, which is different from the dangerous extracellular fluid retention that causes leg swelling and pulmonary congestion in heart failure. But when you are managing severe heart failure, anything that affects fluid distribution in your body deserves medical oversight. If you have stable coronary artery disease, well controlled on medications, creatine is likely safe and may support your exercise capacity as you work on cardiac rehabilitation. If you have mild to moderate heart failure that is well managed, creatine is probably fine, but mention it to your cardiologist. If you have severe decompensated heart failure with active fluid management issues, do not start creatine without explicit guidance from your cardiac team. If you have had a heart attack or cardiac surgery within the past few months, focus on recovery first. There will be time for supplement optimization later. The bottom line, heart disease does not automatically disqualify you from creatine. But severe heart failure with fluid restriction does require a specific medical conversation. If you are following along and finding this valuable, hit that subscribe button right now. I make videos specifically for people over 50 who want real medical information, not generic advice designed for 25-year-old gym bros who think they are immortal. Bipolar disorder. The brain connection nobody warns you about. Second condition, and this one genuinely surprises people. If you have bipolar disorder, creatine could mess with your brain chemistry in ways you really do not want. Here is what happens. Creatine does not just sit in your muscles looking pretty. It crosses the blood-brain barrier like it owns the place. Once it gets into your brain, it influences energy metabolism in neural tissue. For most people, this is actually beneficial. Improved memory, better cognitive function, sharper thinking. But for people with bipolar disorder, this altered brain energy metabolism can destabilize mood regulation. And when mood regulation gets destabilized in bipolar disorder, you do not just feel a little off. You can swing into a full manic episode. This is not theoretical fear-mongering. Published research in the Journal of Clinical Psychiatry has documented actual cases where creatine supplementation triggered manic episodes in individuals with bipolar disorder. The cruel irony here is that creatine has shown promise for regular depression, the unipolar kind without the manic component. So people read those studies and assume creatine helps all mood disorders. It does not. Different brain wiring, different rules. If you have bipolar disorder, do not start creatine without explicit approval from your psychiatrist. They need to weigh potential benefits against the real risk of mood destabilization in your specific case. This is non-negotiable. If you have a family history of bipolar disorder but have not been diagnosed yourself, there is no clear evidence of increased risk. But be aware of this connection and monitor how you feel if you start supplementing. This is the kind of information that could save someone from a seriously bad experience. If you know someone with bipolar disorder who is considering creatine, share this video with them. They need to hear this before they learn it the hard way. Advanced kidney disease, the non-negotiable red line. If you have stage 4 or stage 5 chronic kidney disease, creatine is off the table until a nephrologist specifically tells you otherwise. Let me explain why, and pay attention because this is where most confusion lives. When you take creatine, your body converts it into creatinine. Creatinine is what doctors measure to estimate your kidney function. So when you supplement with creatine, your creatinine levels go up. This is not kidney damage. This is basic biochemistry. More creatine in, more creatinine measured out. The problem? Most doctors see elevated creatinine, panic immediately, and tell you that you are destroying your kidneys. I have heard this story hundreds of times. People getting scared off creatine because their doctor does not understand the difference between elevated creatinine from supplementation versus actual kidney dysfunction. For people with healthy kidneys or mild kidney impairment, stage 1 through stage 3, this is a non-issue. Studies show no acceleration of kidney decline with standard creatine doses. Your kidneys handle it just fine. But here is where the line gets drawn. If you have stage 4 or stage 5 chronic kidney disease, your kidneys are already struggling. They are working overtime to filter waste products with significantly reduced capacity, adding extra creatinine to their workload, even though creatine itself is not directly toxic to kidneys, creates additional filtration burden on organs that cannot afford it. The 2025 Frontiers in Nutrition Review specifically states that individuals with advanced kidney disease should avoid creatine until more targeted research is available. If you are on dialysis, the answer is also no. The altered clearance kinetics and fluid management requirements make supplementation unnecessarily complicated. Now here is the actionable part. If you want to take creatine and you are concerned about kidney function, get tested properly. Ask your doctor about cystatin C testing, which is not affected by creatine supplementation. This gives you accurate kidney function assessment regardless of whether you are supplementing. If your doctor does not know what cystatin C is, you might need a more informed doctor. Just saying. If you have mild kidney concerns but function is stable, you are likely fine with standard creatine doses and proper monitoring. If you have advanced kidney disease, this is not your supplement. Focus on what your nephrologist recommends instead. That was important information. If you are learning something new, hit that like button right now. It helps more people find this video who actually need this information. Active cancer treatment. The complicated conversation you need. 2. Have fourth condition. If you are actively undergoing cancer treatment, creatine requires a conversation with your oncology team before you make any supplementation decisions. Let me explain why this is complicated, because it genuinely is. Some cancer cells have been shown to upregulate creatine transporters and creatine kinase expression. In plain English, certain tumor cells appear to actively seek out and use creatine as part of their energy metabolism. This has been observed in prostate cancer, breast cancer, colorectal cancer, and several other tumor types in laboratory settings. That sounds terrifying, and I understand why people get worried when they read about it. But here is the critical distinction that gets lost in translation. Laboratory findings in petri dishes and mouse models do not automatically translate to what happens in actual human beings. When researchers study real humans who supplement with creatine, they do not see increased cancer incidence. Large observational studies actually show that people with higher dietary creatine intake tend to have similar or even lower cancer rates compared to those eating less creatine. Some research even suggests creatine may support immune cell function and help the body fight cancer more effectively. And during cancer treatment, muscle wasting called cachexia is a serious and sometimes life-threatening problem. Creatine's potential to preserve muscle mass during chemotherapy could provide real clinical benefit. So why am I listing this as a contraindication? Because cancer is not a situation for general advice from YouTube videos, even detailed ones like this. If you are actively undergoing chemotherapy, radiation, immunotherapy, or other cancer treatments, your oncologist needs to weigh in on any supplementation decisions. They understand your specific cancer type, how it behaves, what treatment protocol you are on, and how everything interacts. If you are on active surveillance for slow-growing cancer, like low-risk prostate cancer, creatine may still be reasonable, but discuss it with your doctor. If you are post-treatment and focused on recovery, creatine might actually help you rebuild the muscle mass you lost during treatment. But again, your oncologist should know about it. The rule here is simple. Active cancer treatment means active medical involvement in supplement decisions. Period. Advanced liver disease. When your factory is struggling. Fifth condition. If you have advanced liver disease including cirrhosis or significant fibrosis, creatine requires medical oversight. Here is why your liver matters in this equation. Your liver is responsible for synthesizing approximately half of your body's natural creatine. The other half comes from your kidneys and gut microbiome. So your liver is essentially running a creatine manufacturing plant alongside all its other responsibilities. When your liver is healthy or mildly impaired, creatine supplementation is not a problem. Studies have not shown liver enzyme elevations or liver damage in healthy adults taking standard creatine doses for months to years. But when your liver is seriously struggling, the equation changes. If you have cirrhosis, advanced fibrosis, or significantly impaired liver function, your liver is already overwhelmed. Its synthetic capacity is reduced. Its ability to metabolize various substances is compromised. Adding any supplement to a failing liver requires careful consideration. Additionally, people with advanced liver disease often develop secondary kidney problems through something called hepatorenal syndrome. This compounds the concern since creatine's metabolite, creatinine, is eliminated through the kidneys. Here is the practical breakdown. If you have mild fatty liver disease, which is extremely common in the over 50 population, creatine is likely still safe. Non-alcoholic fatty liver disease in its early stages does not significantly impair synthetic function. If you have more advanced liver disease with actual functional impairment, check with your hepatologist or gastroenterologist before starting creatine. They can assess whether your liver function is stable enough to handle supplementation. If you have cirrhosis with complications like ascites, varices, or encephalopathy, creatine is not your priority. Focus on managing your liver disease. Most people watching this video have livers that work just fine or have only mild fatty changes. For you, creatine is not a liver concern. But for those with serious liver disease, caution is appropriate. This is exactly the kind of nuanced information you will not find in most creatine videos. If you are finding value here, drop a comment telling me which condition surprised you most. I read comments, and they help me understand what topics to cover in future videos. Pregnancy and breastfeeding. When caution overrides potential benefit. Sixth condition. If you are pregnant or breastfeeding, avoid creatine until we have better human data. Now I know what some of you are thinking. This is a video about creatine after 50. Why are we talking about pregnancy? Fair point. But some viewers are women in their late 40s who could still become pregnant. And many of you have daughters, daughters-in-law, or granddaughters who might ask your opinion about supplements. So this information matters. Here is the current state of the science. Animal studies on creatine during pregnancy are actually quite promising. Research shows potential protection against hypoxic injury during birth and support for fetal brain and muscle development. The theory is sound. Developing babies need enormous amounts of cellular energy, and creatine supports energy metabolism. But here's the problem. We do not have robust human clinical trials confirming safety across all trimesters and in various pregnancy complications. Pregnancy fundamentally alters physiology in ways that change how we evaluate everything. Kidney function shifts. Blood volume expands by 40%. Hormone profiles change dramatically. Nutrient transport across the placenta becomes incredibly complex. Without solid human data, recommending creatine during pregnancy would be irresponsible. This is not me saying creatine is dangerous during pregnancy. I am saying we do not know enough yet to confidently say it is safe. The same logic applies to breastfeeding. Creatine does appear in breast milk, and while this is likely fine since creatine is a natural compound, We do not have studies specifically evaluating supplementation during lactation. If you are pregnant or breastfeeding, skip the creatine. Focus on prenatal vitamins, folic acid, and whatever supplements your obstetrician specifically recommends. There will be plenty of time for creatine optimization after pregnancy and breastfeeding are complete. If you are a woman approaching menopause and wondering about pregnancy risk, that conversation is between you and your gynecologist. But if pregnancy is even a remote possibility, factor this information into your supplement decisions. Uncontrolled blood pressure with fluid sensitivity. The hypertension question. Seventh condition. If you have resistant hypertension that is difficult to control even with multiple medications, or if you have fluid-sensitive blood pressure issues, creatine deserves a specific conversation with your doctor. Let me start by addressing the myth, because there is a lot of nonsense floating around about creatine and blood pressure. Multiple controlled studies have specifically measured blood pressure in people taking creatine. The consistent finding is that creatine does not significantly raise blood pressure in most people. Some studies even show slight reductions, though not consistently enough to call creatine a blood pressure treatment. The confusion comes from water retention. People hear that creatine causes water retention and assume this means higher blood pressure. But creatine causes intracellular water retention, meaning water inside muscle cells. This is different from extracellular fluid retention that actually increases blood vessel pressure. Think of it this way. Creatine makes your muscle cells plumper, not your blood vessels more congested. Your heart does not have to pump harder just because your muscle cells are more hydrated. For most people with well-controlled hypertension on medication, creatine is safe. The research supports this. But here is where nuance matters. If you have resistant hypertension, meaning your blood pressure remains elevated despite taking 3 or more medications, including a diuretic, any supplement warrants careful consideration. Your blood pressure regulation is already complicated. Adding variables requires medical oversight. If you have salt-sensitive or fluid-sensitive hypertension, where even minor changes in sodium or fluid intake cause significant blood pressure swings, discuss creatine with your cardiologist or internist first. While creatine is not high in sodium, the intracellular water shifts could theoretically affect people with extremely sensitive fluid balance. If you have well-controlled blood pressure on 1 or 2 medications and everything is stable, creatine is almost certainly fine. The research does not show blood pressure problems in this population. The bottom line, ordinary controlled hypertension is not a creatine contraindication. Resistant or complicated hypertension deserves a conversation. If you have made it this far in the video, you are clearly serious about understanding this topic completely. Smash that like button and subscribe right now. I create content specifically for people who want real information, not watered-down generic advice. All right, let us bring this home with the summary you can actually use. 7 conditions that require caution or avoidance with creatine. Number 1. Advanced kidney disease, stage 4 or 5, or dialysis. This is the hardest contraindication. Your kidneys cannot afford the additional filtration burden. Number 2. Bipolar disorder. Documented risk of triggering manic episodes through altered brain energy metabolism. Talk to your psychiatrist first. Number 3. Severe decompensated heart failure with fluid restriction. Not all heart disease, but specifically severe cases where fluid management is critical. Number 4. Active cancer treatment. Not because creatine is proven harmful, but because these decisions require oncology team involvement. Number 5. Advanced liver disease with cirrhosis or significant functional impairment. Your liver is already overwhelmed. Number 6. Pregnancy and breastfeeding. The research is not there yet to confirm human safety. Number 7. Resistant hypertension or fluid-sensitive blood pressure that is difficult to control. Not ordinary well-managed hypertension. For everyone else, and that includes most of you watching this video, creatine at 3 to 5 grams daily is remarkably safe and potentially beneficial. It supports muscle preservation, cognitive function, and possibly even bone health as you age. If you do not fall into these 7 categories, do not let fear keep you from a well-researched supplement that could genuinely help you maintain strength and independence as you get older. Do not forget to comment active below to get your free 30-day workout plus creatine guide. This resource shows you exactly how to implement creatine supplementation safely and effectively for maximum results after 50. If this video helped you understand whether creatine is right for your situation, hit that like button. Subscribe if you have not already. Share this with someone over 50 who has been confused or scared about creatine because of their health conditions. Most of them can probably take it safely. Now they will know for sure. Thanks for watching all the way through. You now know more about creatine contraindications than most doctors typically discuss with patients. Use that knowledge wisely. I will see you in the next video.